Good afternoon, everyone. This is Dr. Val R. Cush, Chair of the Montgomery County Board of Commissioners. Today is Wednesday, April the 28th, 2021. We are in week 60 of the COVID pandemic here in Montgomery County. I hopefully will be joined by my colleague, Commissioner Ken Lawrence, a little bit later. We're having a little bit of internet challenge in one of our locations, so hopefully he'll be on with us later. So I'm going to start this afternoon with an update on where we are with the Johnson & Johnson vaccine. After review of the Johnson & Johnson vaccine, the CDC's Advisory Committee on Immunization Practices has determined that blood clot incidents are extremely rare and that the vaccine is safe and effective for all individuals moving forward. This shows that the federal oversight process of vaccine safety and effectiveness is working, and all steps are being taken to protect Americans. As such, the Montgomery County Office of Public Health has resumed use of the Johnson & Johnson vaccine at our clinics starting today. And to show how confident we are in this vaccine, earlier today, Commissioner Lawrence and I were both vaccinated with the J&J vaccine. I want to again thank our clinic staff and volunteers for their work over the last few weeks to make sure our operations ran smoothly during the Johnson & Johnson pause. As of today, we've opened up all of our county-run clinics. They will offer both Johnson & Johnson and Pfizer vaccines. We're also using the J&J one-shot vaccine in our efforts to vaccinate those who are homebound. Our goal remains to get as many shots in arms as quickly and efficiently as possible. Our vaccine clinics are now offering appointments into May, and anyone who books with us will have the ability to choose their clinic location, the date and time of their appointment, and which vaccine they receive. Just a reminder for those of you booking your second dose, you will get an email letting you know when it is your time to schedule your second shot. In our registration system, you will have to pick a date that is at least 21 days out from your first dose. So please keep that in mind when you pull up this calendar to schedule your second shot. Also, as a reminder, if you or a family member have any appointment issues, please email covid19@montcopa.org or call our hotline at 833-875-3967. Now that vaccine appointment eligibility is open to everyone, anyone can register with us to receive the vaccine, and we have plenty of appointments. Now let's take a look at our updated vaccine clinic map. We continue to maintain 7 clinic locations across the county with daytime, evening, and weekend hours. As a reminder, starting next week on Monday, May the 3rd, we're moving the location of 2 of our clinics to better serve our residents. The site at Norristown Area High School will move to our new King of Prussia location at the old JCPenney store. Similarly, our site at Montgomery County Community College will move to the Montgomery Mall. We ask that everyone please take note of these location updates and to double check your clinic location in the coming weeks. If you already had an existing second dose appointment at Norristown High School, it will be moved to the JCPenney store at the King of Prussia Mall. And if you had an existing second dose appointment at Montgomery County Community College, it will be moved to the Montgomery Mall. And at the Montgomery Mall, it is located in the old Sears store. In addition, today marks the start of our walk-up vaccination clinic at St. John's Episcopal Church in Norristown. This clinic will be open Tuesday through Friday from 11 to 3 p.m. No appointments are necessary. Anyone can walk up and receive the Johnson & Johnson vaccine. That's the location where Commissioner Lawrence and I went earlier today, and the setup is great, and I would encourage anyone to stop by there who wants to get a vaccine. ACLAMO staff will be on site at St. John's to assist with Spanish interpretation on Tuesdays and Wednesdays. And I want to thank Nelly Jimenez, the executive director at ACLAMO, and the whole ACLAMO team for this partnership. It was great to see them there today. All of these locations are updated in our vaccine registration system. And when you click in to make an appointment, you'll see a choice at each of these spots. As a reminder, you can register online or by phone to receive the vaccine through our COVID-19 hotline, and that's at 833-875-3967. You can call and pre-register for the vaccine by phone. Let the agent know that you'll need some support in pre-registering, and probably in that same phone call at this point, or within just a day or two, you'll get a phone call back and they will schedule your appointment for you over the phone. We also want to remind everyone that no cost transportation is available to all vaccine appointments at Montgomery County vaccination clinics, and that includes any location in the county. So this can be to a retail pharmacy or any location where you want to make an appointment. There's three options through Transnet, SEPTA, and GoGo Grandparent, and these are all no cost for Montgomery County residents. You can call the numbers listed on your screen, or you can also call that hotline number and they will help you get connected. Now I have a brief update on the new CDC Mask Guidance that was released yesterday. The CDC issued new guidelines saying that Americans who are fully vaccinated against the coronavirus no longer need to wear masks outdoors if they're walking, running, hiking, or biking, either alone or with members of their household, or in small outdoor gatherings. And I just want to remind everyone that you're not fully vaccinated until 2 weeks have passed from your second dose of a two-dose vaccine or your single dose of Johnson & Johnson. So even though I was vaccinated today, I am not going to be considered fully vaccinated until 2 weeks from today. In addition, the CDC stated that unvaccinated individuals do not need to wear a mask if they hike, jog, bike, or run alone or with a household member. People who have not gotten their shots can also go without a mask to small gatherings held outside as long as they are with fully vaccinated friends and family. The guidelines were further relaxed for fully vaccinated people. You can now take off your mask when you attend small gatherings with people who haven't gotten their shots and when you dine at a restaurant outside with people from more than one household. However, the CDC has stopped short of allowing fully vaccinated people to shed their masks altogether in outdoor settings. That's because there's still a risk of transmitting the coronavirus. There are unknown vaccination levels among people in crowds, and many areas around the country, like ours, still have very high caseloads of COVID-19. So even with this new guidance, it's still not quite the time to let our guard down here in Montgomery County. We still must stay vigilant as the virus does remain quite present in our community. So let's see how we're doing with our update of vaccinations. This is the best way to get us back to normal as quickly as possible. And I'm happy to report that we continue to make really good progress. So we'll walk through this chart. On the upper left box, you can see the county administered vaccinations by clinic type, and this is as of yesterday, I believe. So we have now given a total of 85,458 first doses and 59,844 second doses. And these are just the doses given by our Office of Public Health or our first responder clinics or our mobile vaccination clinic. And then in the bottom left, you can see the different brands of vaccine and how many of each one our public health teams have given. And then on the upper right, let's start all the way over on the right. So for the percent of individuals who are 65 and older that live in Montgomery County, I am really happy to report that 93.09% of those individuals are either partially or fully vaccinated. 93%. So that is fantastic news. It means that the most vulnerable individuals in our community are well on their way to a high degree of safety. When we look at the next column to the left, this measures the percent of individuals 16 years of age and older who live in Montgomery County. And we're doing very well there too. We now have 60.47% that are partially or fully vaccinated. And then when we look at this as a percent of our total population, remembering that anyone under 16 is not yet eligible to be vaccinated, we are doing pretty well. We are at 48.99% of the individuals being either partially or fully vaccinated. And remember, this includes all of the children who are under 16 that aren't even eligible to be vaccinated yet. So this is great news and great work by our community. So keep it up. Let's get everybody who wants to be vaccinated vaccinated. Now, as you know, we've been carefully tracking the race and ethnicity of the vaccinated population here in Montgomery County and comparing that data with census data for the racial and ethnic composition of our community. As you can see in the bottom right-hand box, we are making steady improvement week over week in reaching all members of our community. For example, individuals that identify as African American or Black make up 9.6% of our population and 6% of the vaccinated population. This is an increase from 5.8% of the vaccinated population last week. We continue to ask people to please identify your race and ethnicity when they register for an appointment. You can still see that we have 1 in 7 people who have not identified a race and 1 in 4 people who have not identified an ethnicity. We are using this data for only one purpose, to make sure that we don't leave anyone behind in our efforts to vaccinate everyone in Montgomery County who wants to be vaccinated. Now, moving on to our regular update, since the April 21st press briefing, we have had 1,214 new cases of COVID-19 reported in Montgomery County for the dates inclusive of Wednesday, April the 21st through Tuesday, April the 27th. This is a daily average of 173.4 cases and brings us to a total of 56,696. These positive cases are all a result of a positive test for the virus, not from the antibody test. 11 of these were from long-term care facilities, 3 were from the Montgomery County Correctional Facility, 4 were from Norristown State Hospital, 7 were from other congregate settings, and 1,189 are from our community. These positive individuals are from 60 municipalities, and all 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals ranged in age from 1 month old to 96 years old. And as always, you can check our county map on our data hub for more information. It can be found at www.montcopa.org/COVID-19. Today, we had 588 females, 618 males, and 8 unknown. In terms of variants, we are now up to a total of 265 individuals that have been identified as having a variant of the coronavirus. We remain with that UK or British variant, the B.1.1.7, as our highest number of variants. We have 246 cases identified with that. We have 6 cases of the B.1.427 variant, 12 cases of the B.1.429 variant, and 1 case of the B.1.526. I am sorry to confirm that 13 additional Montgomery County residents have lost their life to COVID-19, which brings us to a total of 1,289 deaths confirmed positive from COVID-19. These 13 individuals ranged in age from 51 to 90. 11 died at a hospital, 1 at a long-term care facility, and 1 at a residence. Overall genders for the individuals who've lost their life to COVID-19, 657 females, 632 males, and they have ranged in age from 25 to 106. In terms of the racial breakdown of this group, we have 2 American Indian or Alaska Native, 35 Asian, 9 Asian Indian, 6 Asian Korean, 155 African American or Black, 688 white, and 414 unknown. Our situation remains stable at the Montgomery County Correctional Facility. Routine antigen testing is underway for all correctional officers. We are in the process of offering vaccination to all inmates who wish to be vaccinated, and any inmates that have tested positive for COVID-19 are stable without symptoms and in isolation. Our positivity rate is slightly decreased, so that's some great news this week. Our 14-day average positivity rate is now 7.7% as of Thursday, April the 22nd, compared with 8.22 as of Thursday, April the 15th. As a reminder, good. As a reminder, a positivity rate below 5% is considered suppression of the virus. And this graph shows our daily positivity rates for March the 26th through April the 22nd. That red line represents the 5% bar. And unfortunately, for the last 28 days, we have not fallen below 5% on a single day. So we have some work to do, but we can see that the trend is finally starting to come back down. Not surprisingly, our hospitalizations are continuing to decrease, but effectively remain stable. Hospitalizations are always going to lag behind cases. So today we have 226 individuals with COVID-19 hospitalized in a Montgomery County hospital. This is a very slight decrease from 228 last week. 8% or 18 of these individuals are requiring a ventilator, and that is the same as last week. Our hospitals do remain busy with both COVID cases and non-COVID cases. And just to put this into some context, back in the beginning of October, on October the 1st, there were only 24 patients hospitalized with COVID-19 in Montgomery County. In terms of testing, we continue to see a lot of people tested, which is great. For the 14-day period ending April the 22nd, 40,885 Montgomery County residents were tested. This is a decrease of 1,102 people tested compared with the 14-day period ending April the 15th. You can see our date tested graph in front of you. The gray bars are a number of positive cases on any given day. And then the red and pink lines are the 7-day and 14-day average of the total number of cases. The dark blue and light blue lines are the 7-day and 14-day average of cases that are entirely from the community. And the orange and yellow lines way down at the bottom are the 7-day and 14-day averages of long-term care facilities. So you can see that we appear to be turning the corner, and hopefully that this is the case. We can now zoom into the last couple of months, and you can see that we definitely are plateauing and appear to be on our way down, which is great news. We continue to have plenty of testing available, so I want to urge anyone who wants or needs to be tested to get tested. All 6 of our sites remain open Monday through Friday with varying hours each day. To make an appointment, you can go online at www.montcopa.org/COVID-19 and click on the COVID-19 testing header at the top of that page. Appointments open up at 7 a.m. on the day of testing. You can also register by phone. That opens up at 8:30 every morning at 610-970-2937. So remember, while all of us want to be done with this virus, the virus is not done with us. We still have a lot of virus in our community, but there is a simple and safe step you can take. Get vaccinated. No matter who you are, it is now your turn. We have plenty of appointments, so make one and please get vaccinated. One announcement today, there continues to be virtual town halls about the vaccine, and we encourage anyone with questions to tune in. Our partners at the Montgomery County Immunization Coalition have joined forces with the Tri-County Health Council, ACLAMO, Berks County Community Foundation, the YWCA Tri-County Area, and Univision on a COVID-19 vaccine virtual town hall scheduled for Wednesday, May the 12th at 7 p.m. During this interactive town hall, speakers will discuss COVID-19 vaccine myths, facts, and access to the vaccine and answer your questions. Attendees can submit questions in advance or ask them live. This conversation will be in Spanish with English interpretation available. Register today at www.pottstownfoundation.org/town hall. That's pottstownfoundation.org/town hall. So that is it for me. Todd, is Commissioner Lawrence on?
He has not joined us yet.
Okay. Then with that, I will announce that our next virtual briefing will be Wednesday, May the 12th. Let me say that again, Wednesday, May the 12th. We feel that we're at the point where we can move to every other week unless something comes up that would necessitate us coming back and talking with you sooner. But for now, we're planning our next briefing for Wednesday, May the 12th at 1:30. And with that, I'm happy to take questions.
Our first reporter will be Kenny Cooper from WHYY.
Hey, I don't have any questions at the moment.
Okay, thanks.
Next, we'll go to Justine McDaniel from the Philadelphia Inquirer.
Good afternoon. I was just wondering, with kind of the changing landscape, when exactly do you think you might see the mass clinics winding down and turning more primarily to outreach or changing the function of the mass clinic model, if you foresee that?
Yeah, I'll have a better sense of that in a few days. We still had 18,000 people in our line here at the county that had registered with us, who had all registered within the last 10 days or 2 weeks. So all of those individuals have now received appointments, and we'll see how many of them still need an appointment. So we'll have a better sense in the next few days. But as I did mention, we already have one clinic that's entirely walk-up, and it's very likely that soon we will enable other clinics to go to walk-ups as well. One of the reasons why we did move two of our clinics to a very popular and centrally located shopping malls is that we're hoping to get people who maybe are out on an errand and they can just walk in and also get vaccinated at in a really convenient way for them. So we will continue to have those remain open. Of course, our mobile vaccine units are still out, helping to get to people who would find it really difficult to come into a vaccination site. And as you can see by our map, we've opened up a number of clinics that are located in communities and churches and other trusted places. And so I think that work will also go on for now as well. So we have been, as we've done through this entire pandemic, just constantly pivoting to serve our constituents in the best, most comfortable way for them that we can. And I'm sure that this will continue to evolve with our vaccines as well.
Thank you. And then I know the Johnson & Johnson, it's only been a few hours since your sites reopened today. Have you heard at all any concerns about hesitancy from workers at those sites who are inoculating people?
Not yet. I was only at the one location today in Norristown, which was a walk-up, and we had a pretty steady stream of people coming in. So I was really encouraged to see that. And again, just want to reiterate that Commissioner Lawrence and I have full faith and trust in this vaccine, and that's why we both went ourselves today to the Norristown site to get vaccinated.
Thank you.
Thanks.
Our next reporter will be Chris Shoemaker from the Intelligencer.
Good afternoon. Just one quick question. Are you getting are you getting any reports of people skipping second doses?
I've heard that from other places. I don't believe that we have seen much of that yet. The last time I saw the data, which was about 2 weeks ago, it was in the very high 90s percentile, percentage of people coming back. So we'll see if we can get an update for you on that, but not that my team has mentioned.
Okay, thank you very much.
Sure.
Next, we'll go to Deanna Durante from NBC 10.
Hello. Just a quick question as workplaces, especially in Montgomery County, are beginning to tell their workers about plans to return to the offices. Um, what do you think it's too soon for those plans? And what, if anything, is the county working on with employers, or what is it that you recommend that they do to change the office landscape since we're still not there with herd immunity?
Yeah. So our Office of Public Health, particularly division led by Pam Lawn, who does a lot of our environmental field services work, is always available to do a consultation with any business that wants to just ask some questions about their setup or see if there is a way they can do it better or just get any the latest updated guidance. And they can just reach out to her. But in general, the most important thing is that people get vaccinated. So the more people that get vaccinated, the safer every single workplace will be. And now that every single person who's 16 years of age and older is eligible to get a vaccine, that would be my number one piece of advice. In terms of timing, it really is up to the business. I mean, there have been businesses operating in person because they had to throughout this entire pandemic and have been able to do it safely as long as they are taking all the mitigation measures like masking and social distancing. So I think that each workplace will have to look at who in their workforce is vaccinated, how many people are they trying to bring back and into what type of location. But it is certainly going to be important to continue wearing masks and maintaining social distancing for any business that is intending to bring people back right now, because as you point out, we are not yet at herd immunity in terms of vaccinations.
And how do you know when we get there? I mean, we've seen our numbers go up and down. How do we, as the general public, know that we're there at this herd immunity?
Yeah, that's a great question. So we will be looking at two things here in the county. One, it will be not just our positivity rate, but as these numbers hopefully continue to come down, looking at our incidence of cases per 100,000. We are still well over 100 cases per 100,000 population. So we will be looking for that number to get way, way, way lower, like down into the 30 to 50 cases per 100,000 range. And then we will also be tracking what percentage of our population is vaccinated. And as you saw earlier, we do have a pretty good handle on those numbers. And once we see that incidence coming down, that positivity coming down, and our percent of vaccinated residents getting up into the 70s, hopefully close to 80%, then we should be in a pretty good place.
Do you one more question on businesses? I was in a local business and I was told by the owner, I can't wait until these plastic sheets and plastic things come down and I don't have to take temperatures anymore. Do you foresee a time where that happens, or is that the new state of doing business post-pandemic in places where you have close contact with people, like hair
Yeah.
salons and nail salons and those other places?
Yeah. I don't know that we have the answer to that yet. I think it's going to depend on what happens with these variants and what percentage of our population decides to get vaccinated. Those are going to be two very important factors in making some of those types of decisions.
Thank you.
Our next reporter will be Carl Hessler from the Pottstown Mercury.
All my questions have been answered today. Thank you.
Thank you.
That concludes our questions for today, Commissioner.
Great. All right. Well, thank you, everyone. And we will see you on May the 12th. Take care.